as well. If anyone wants to make their way forward, I feel a little bit lonely at the front. I love how everyone stands at the back. Thank you so much for making the time to come with us this afternoon. It is our absolute pleasure to get to share with you today. So I get to introduce our two speakers. But before I do that, I just wanted to share a little bit of housekeeping before I get into introducing our two amazing speakers today. So in the hopefully unlikely event of an emergency, if I could just ask that you have follow the instructions of the fire warden and make your way down to the muster point at Hay Street, making sure that we use the stairs in the event of an emergency. There are toilets located on this level in the doors behind us, down the corridor. You've got the male and female toilets, and there's an accessible toilet on the ground floor as well towards the back of the building. I would also like to acknowledge the traditional owners. Maybe I won't move. So the traditional owners I would like to acknowledge the traditional owners of the lands on which we are meeting today, the Whadjuk people, and pay my respects to their elders, past and present. I would also like to acknowledge their continuing contribution and culture to this amazing city and to this land that we are on at the moment. So to start today's formalities, I would love to share with you how this all started in the COVID-19 WA lockdown, where the Centre for Transformative Work Design actually partnered with the WA state government to really understand the new flexible ways of working that were happening as a result of this pandemic, and with the aim of really understanding how we could provide resources for managers and employees in really utilising and understanding how to get the benefits out of these new ways of working. And so with that, we today are going to share with you these resources. We're also going to share these new developments with the Thrive at Work framework and including our new platform. And so without further ado, I'd like to introduce our first speaker, the incredible Professor Sharon Parker, who's the Australian Research Laureate Fellow and the Director of the Centre for Transformative Work Design at the Future of Work Institute. Sharon is a Professor in Organisational Behaviour and also the recipient of the ARC Fitzpatrick Award.
You got most of it.
And she is also a Chief Investigator in the Centre for Excellence of Ageing and Research in the Mature Worker and Organisations stream. So without further ado, I'll hand over to Sharon.
Welcome everybody. It's absolutely fantastic to see you all here today. We're very excited to share with you some of the work that we've been doing during COVID. And as you know, some people during COVID got less busy because they couldn't do their work, and some people got more busy, and we certainly got more busy during COVID. What the plan is that I will talk to you just very briefly about some of the findings from the work from home study that we did during COVID. And I'm also going to launch officially the resources that we are getting out there today. And I'm just going to note we're going to release these also online in a webinar format later next year. So we'll make sure we let you know about that. And in those webinars, we'll go into more detail. We're not going to do that here today because we don't really have time. And then I'm going to pass you to Karina, who's going to give you the update on some of the developments with our Thrive at Work project that I know many of you are already involved in. So that's the plan. And just very briefly, you all know that pre-COVID, flexible working in Australia existed, but it wasn't particularly common. And in fact, we don't really even have very good statistics on it because the estimates there of 9 to 20% come from the Australian Bureau of Statistics. But they ask this very weird question, like, do you sometimes work from home to catch up? And if yes, that gets included in flexible working. So it's a bit of a dumb statistic. Even so, even including those people, you can see those statistics were pretty low. And really, flexible working applied mostly to the privileged few, people that were trusted, and people whose work are suited and so on. And then of course we had COVID and everybody, just about, not everybody completely, but many people had to work from home. They had to do it without necessarily choice, even if the work was unsuitable. We didn't have time to have policies and training and all the things we'd normally do with a big change. We had homeschooling, childcare challenges, and many more. So it was really important to take stock and say, what has this experience been like for people, and what can we learn from it? Because of course, many of you are here because your organisations are wanting to continue to embed flexible working, perhaps more so even now. We keep talking about the new normal of flexible working into the future. So we did this study, and I need to credit here Caroline, who's standing up the front, who led this study. What we did was, we started in April. We actually had more than 1,000 people do it, but we've tracked people over time, first once a week for 4 weeks, and then once a month. And I think we're now up to wave, what are we up to now?
10.
Wave 10. So there's some wonderful people out there who've done our survey 10 times, who we are very grateful for. And that really allows us to understand not just what was COVID like what was it like to work from home at that time, but how has it changed and evolved, and how have people adapted. I won't go through the details of the study, but there's a stand here that Caroline's standing right next to, which tells more about the study and also where you can get more information about it. But one of the things we found was that psychological distress was much higher during COVID. So this here is the percent of people who experience high or very high psychological distress. And you can see that before COVID, we're talking about 12-13% of people experience, which is already too many, let's face it. But then during COVID, that number went up to 22% of the people were saying that they are very distressed at this time. And I think one of the questions we should ask is, well, is this just the pandemic? Is this just people worrying what's going to happen? Am I going to get sick, etc., etc.? So that's a very important question to ask. Or is it something else? And I'm going to come back to answer that in just a minute. We also asked people about their productivity. And we actually found that pretty much 1/3 of people felt less productive during COVID, 1/3 about the same, and 1/3 more. And if we can ask the question again, those people that were less productive, is it just because the work wasn't really suitable? Or is it something else? And this is where modelling comes in, where we actually measure a whole bunch of things and then try to predict people's distress and people's productivity. And without going through the detail, one of the things that we've done is we've systematically looked at the way that people's work was designed during COVID and then matched it against outcomes, including mental health, but also including performance sorts of outcomes. And what those little circles there indicate is the strength of the relationship. So what you can see, for example, is that people were more satisfied with their work if they had stimulating work, if they had mastery in their work, if they had agency, if they had strong relational aspects to their work, and if they had tolerable demands. And if you don't know what I'm talking about, you need to go over to the stand over here, which unpacks our SMART model of work design. And so the message that comes from this is if we want less distress for people when they're working at home, if we want more productivity, we need to design smarter work for them. So that's the fundamental message. And I just want to share with you these hot off the press results that Caroline has just literally modelled last week. And what these show are people's change in distress over time. And what you can see is that there's a group of red, the red there, those people's distress gets lower over time. So it gets lower and then sort of stabilises. And then there's a group of people whose distress gets higher over time. And so then we say, well, what predicts who's in those categories? And what we find is that people who had a lack of stimulation in their work, so who had underload in their work, so they didn't really have enough to do, which most people don't want. We think we don't want much to do, but actually if we don't, it's not really good. So those people's distress increased over time. People who were monitored closely by their manager in the early days, their distress increased over time, and that's part of what we call agency. And people who had a lot of homework conflict, which we would see as low intolerable demands, their distress also increased over time. And then we can look at what predicts the people whose distress got better over time, or lower over time. People who had very strong support from colleagues. This is a really important predictor. So whatever you do as a manager, making sure that people support each other is really important. We also found that people who had experience working from home, they adapted more quickly and their distress improved over time. So the key takeaway from this little tiny snapshot, I asked the question before, is that higher distress, is it just the pandemic? And I asked the question before, if people are less productive, is it just that the work is not suitable? And the answer to that question is no. Smart work design also plays a really important role. And so building on that research, but also building on the vast amount of research that's already been conducted by many other researchers, both pre-COVID and also during COVID, we are so excited today to launch some new resources. And I want to thank the West Australian State Government for funding this project. So by the people that are here today, I think there's plenty of interest in it. Our resources are evidence-based. We pride ourselves on trying to give advice that is grounded in research, but we don't want it to be all boring and stuffy and academic. We also want it to be practical. So we also draw on examples from organisations. And it complements a whole bunch of other resources that we've already developed. And if you haven't discovered our website by now, then you failed in your mission today, because that's one thing we would really like you to come away with today. And you can access those resources. During the COVID, I did lots of blogs and videos, which are really embarrassing to watch now, but they do exist and they do provide some guidance. So what we have in the last 1 minute of what I'm going to talk about, we have guidance for workers. So this is people who are working, because they can take responsibility and manage how they work from home. So for example, we can ask people to reflect on, are you a segmenter? Are you someone who keeps work and family different, separate from each other? Or are you an integrator? Are you someone who blurs all these things together? Because the research shows that depending on which you are, will influence how well you cope with working from home. And I'm not going to tell you the answer about which is best. You're going to have to read the resources. So I'd like to thank Kim, wave your hand, Kim, who is the first author of this really fantastic guidance. So get your workers to reflect on how effectively they are working. But it's not all the workers, it's also the managers have to think about how they manage people. And our second guidance from Kiri, where are you, Kiri? Okay, right next to Kim, is all about how do you manage virtual teams. And actually there's this huge literature on if you have to coordinate people's actions, even though they're geographically dispersed, and often dispersed in terms of time zone as well, how do you do it? And how do you use the technology in the best way? And which sort of tasks work well to coordinate using technology, and which should you absolutely try to do face-to-face if you can? There's a question for you. I'm not going to tell you the answer. You're going to have to read the resources. So thank you very much to Kiri for that wonderful review of that literature on virtual work, which you will enjoy. And then our final guidance is really more a little bit about, as a leader, as a manager, what sort of policy might you need to have in place, and what are the important things to think about if you are creating a policy. But of course, we all know that policy is one thing, so it's got to be deeply embedded in the practice. And so what are the practices that people should be putting into place? And Lena's walking around with a robot following her. Where is she? So thank you very much to Lena, who's the first author on also a really helpful resource. So as I said before, we're going to release those individually online, because that's what we do now, right? And we're going to have the Zoom conference. So we will make sure we invite you to that, and it'll be an opportunity to just delve a bit more deeply into each of those resources. I'm going to pass you over now to Associate Professor Karina Dritsma. Let me just say a little bit about Karina. I bet pretty much everyone in this room knows Karina. Can you raise your hand if you know Karina? Yeah, so she sort of needs no introduction. But she is she's the inaugural, the very first Professor of Practice at Curtin University, acknowledged for this because she is such an amazing applied researcher who works with all sorts of organisations. She brings in loads of money, and she is a superstar, and we're very happy to have her. That's all I'm going to say about Karina. Welcome, Karina. She's going to update on slide.
Okay, I don't really know how to smoothly segue in after that. So thank you all for being here today. I guess just sort of, whilst the main purpose of today is actually to kind of officially launch the resources, and as Sharon said, we definitely would like to have some more sessions where we actually unpack and walk through those guides and some of the findings and things of those over the coming months. We also just wanted to take an opportunity to update as to where we're at with the Thrive at Work initiative. So some of you will be familiar with the Thrive at Work initiative, others won't be, so I'm going to do a very quick kind of run through of where we're at around that at the moment. And so if you are not familiar with the Thrive at Work initiative, the Thrive initiative is a well-being, a workplace mental health and well-being initiative that we began probably formally in 2017 with some foundational funding from the Mental Health Commission and the ARC. We spent a long time in the spirit of what Sharon was also saying about not just being academic and research-based, but really practical as well. We really looked at working with organisations and leading mental health bodies as well to come up with a framework and some tools to help organisations navigate through mental health and wellbeing. And I guess just when we began and we were really looking at this space, we saw that when organisations were talking about mental health and wellbeing, they came from three kind of approaches. One was this ill health lens and the public health lens of reducing absenteeism, workers' comp, ill health. Another was the legislative lens of psychosocial risks and from that protection end, and the other was the future of work in terms of preparing people for the changing nature of work. I think it's kind of interesting to reflect on this now because it kind of feels like we were kind of saying all of these things and look what happened with COVID, right? Like I think it's made the case for itself. I don't think ever have we been in a spot where people actually are looking at workplace, work, mental health and wellbeing, that's there. Also, as we're grappling with psychosocial risks and what does that mean and really unpacking what that means. And the future of work, we kind of kept going, the robots are coming, and everyone went, meh, and now, look what happened, right? Like, we actually are in a space of constant rapid uncertainty and change that's there. And so we think Thrive at Work, we had for a while, and as Sharon has put all the blogs on Thrive at Work at Home, kind of section that's there, but it all falls, I guess, as all pieces of the puzzle that we have here, and we see the resources as just an unpacking and a furthering of this that's here. So yeah, the Thrive at Work and the framework is really about bringing all of those lenses together to look at how we support people, regardless of cause, experiencing ill health, the prevention of harm and the promotion of thriving. And I'm not talking about this in a lot of detail, but what we have is a framework that brings all of those things together. And I just very briefly wanted to talk about today the fact that the majority of the work we've spent the last couple of years on is really getting into the what to do, how to things, and the measurement, including employee wellbeing. So we are also sort of launching the platform at the platform today. And Megan over here with the stand, you can actually play around with the survey platform that we've used as well. And there's lots more resources that are there. So if you actually, I'm going to move beyond that, but just to sort of say, other than the framework itself and what's there and bringing all of this together, some of the stuff that we think is really important, we hope we can actually help around resources around, is this business case and why is this important? Also, what are the ways in which you can assess where you're at, how are people going, how are they tracking, and methodologies for that, and really also the development of a community of practice. So we are about to endeavour or launch a public sector masterclass series where we'll bring together a number of agencies, and that will be the start of one thing, but I mean we're all here in some ways as part of an ongoing community of practice as well. And just so you kind of know, one of the things that we have is an audit. You can find this on the website, but where it's the how-to, taking stock of what are you doing in your organisation. Then there is the worker experience, and I encourage you to take a look and play around with the platform as an avenue for that. And then the linking of the strategic data. The work from home study, led by Caroline, is an example of that, really not just looking at cross-sectional data too, but looking at these trajectories of people over time, which I think is the important part of what we can add to the conversation as well. And so yes, we're pretty proud of the platform, but we had sort of said for a while, hey, not only should you look at what you're actually doing in your organisations, you should look at how people feel in the space as well, and in a real absence of there being good surveys and available ways for people to take stock of employee perceptions in that space, we have made our own. And we have put in there also a lot of things that include immediate feedback for participants, and so resources and so workers can actually, or employees can learn in that space, as well as for the decision makers and people to be able to look at and cut that data and actually see where are some of the relationships between the variables and those types of things that are there. We have accumulating case studies, tools, best practice guides on the Thrive at Work website, which you can access. There is the Thrive at Work website. I think if you Google Thrive at Work, it comes up as the first thing still. So you'll find it there. It also links out to smart work design, the smart that you see around here, which will speak more to what Sharon was mentioning today around smart work design principles. On that, there's a research link too, which sort of speaks to different current studies that are open for people to participate in. One that's an example here at the moment is investigating the experiences of workers and mature workers and organisations during COVID, which we're still looking for, so you can click on that from there. And there's lots of other things other than the resources that are online as well, including Sharon's blogs, which I'm glad I didn't do, but I'm very thankful that you did, and I do find it quite useful, including the birds chirping in the background. That were there. But really, I just want to thank you all for coming today. I know we haven't given you any depth of information that's there. We're actually hoping to direct you to all of the resources that are here today. And there is the work from home resources, there's information on the smart work design, there's information on the actual global longitudinal study. There is a stand where we actually worked with police and did a study of flexible work practices for them. It was meant to be whilst everyone was at home, but then the public sector got sent back to work ASAP, so we didn't quite get there. And information on the platform. And yeah, very happy to be out and chat with you all after this. That's it.
Thank you so much, Karina and Sharon, and thank you everyone for coming today. We really appreciate having you here and getting to hear some of your views of these resources, and we really hope that you do find these useful. So please feel free, while this is the end of the kind of formal part of today, we would love if you could just spend some time talking to the researchers and really getting to have some time with the stands and getting to use these resources and see how useful they could be. So thank you so much, and we look forward to chatting with you.